Here we're gonna cover the muscles and many of the disorders that can occur, or muscle diseases and problems that may occur with the muscle system. So keep that in mind as we go through. You'll find this many of these diseases in your book. So just a moment. Here are some disorders of the muscles. Um, First one is atrophy. Atrophy can occur due to lack of use of a certain body part or a muscle system. Many times, patients who become paralyzed, their lower extremities become atrophied. They become unable to sustain weight because of lack of use, and they get smaller in size um, and girth. So so if it is very true. If you don't use it, you will lose it. It will shrink. Um, so you have to keep the nutrition demand up in your muscle system so that it will maintain, keep building and breaking down proteins. So it's important to remember that amino acids have to have a supplement, a nutritional supplement, and be stressed in order to build up and sustain its tonability. Now, muscle strain is simply what it is. I mean, we've certainly picked up objects that have weighed too much and strained our backs, and some of us have experienced that. I have, and don't want to do it again. It was pretty bad. But sometimes we get caught in these situations where we just overuse our muscles, and it's the tearing of the muscles what happens, and rest and relaxation is usually the way to that allows it to heal. Then we have muscle spasms. Many people call these Charlie horses, leg cramps, right? Um, uh, their spasms can occur in any muscle in the body, but often happen in the leg. And the muscle is a spasm that contracts without your control and does not relax. Muscle spasms often occur when a muscle is overused or injured. Uh, Things that might bring on the muscle spasm include hot and cold, something as simple as that, being dehydrated, having low levels of minerals, as I discussed in a previous lesson, potassium and calcium. Some persons occur, some spasms occur because the nerve that connects to the muscle is irritated. So that nerve could be just irritated, and it keeps firing, and the muscle keeps contracting. Remember, when the neurons fire, the muscle contracts. Okay, relax, fire, contract. So it pulls, it flexes. One example is a hiatus disc that irritates the spinal nerves and causes that's your lower back, the disc in your spinal cord. Um, it can cause spasms in the back muscles. Uh, Spasms in the calf often occur. That's one of my favorites, right in the back of my calf, while kicking, during swimming or running. They can also happen at night when you're in bed. This is leg restlessness can occur. And lack of sleep, believe it or not, can be a cause of muscle spasms. Not getting enough rest, not relaxing, because a lot of our activities that we do during the day are repaired at night during our sleep. And if we don't allow that cycle to occur on a regular basis, those repairs are simply not being going on or not being accomplished. So remember to drink plenty of fluids, eat nutritiously, and get your sleep and exercise. We have some more disorders. Malaysia is aches and pains, painful aches and pains. They're common and can involve more than one muscle. Muscle pain also can involve ligaments, tendons, and fascia. Fascia and ligaments. Uh, we covered ligaments before. That's where you connect the bone to the bone, and then tendons are where you connect muscle to bone. And then you have fascias. That's soft tissues that is connective tissue, and we'll be covering that later on in the slides. Um, but it's related to the pain. My means muscle, and aglia means pain. So in the terms, you ever see aglia, you know that whatever that is causing pain. And my just is the general Greek or Latin shortness for muscle. Then you have dystonia. That means tone. Um, your tone, right? So involuntary muscle contractions, so the tone of the muscles is by repetitive movements of a normal posture. So um, it's important to understand that we should consider that these can be very painful as well. So we're still dealing with pain, right? So muscle pain is most often related to tension, overuse, muscle injury from exercise or hard physical work. The pain tends to involve specific muscles and starts during or just after the activity. It is often obvious which activity is causing the pain. So if you, many times the doctors say, well, while, you go to the doctor, this hurts when I do this. And the doctor looks at you and goes, well, stop doing that. Well, that, believe it or not, is a form of treatment because it sounds funny, but it's a very true statement. You got to give time for your muscles to heal. And if you keep using it, they're not gonna heal. Um, and that's what they're basically saying. You have to give it rest. You have a hernia. This is an organ that protrudes through a weak muscle. The hiatal hernia is the stomach or esophagus protrudes through the diaphragm. The umbilical hernia, intestines protrude through the umbilicus. In inguinal hernia, intestines protrude through the inguinal area or the groin area. So I know that the hernias are, happen to a lot in men who are overstressed and move heavy objects. They can tear their muscles in their stomach area and cause their organs to protrude through the cavity of the muscle tissue. So it's quite common to have a hernia. Just a moment. Here we go. Flat feet. One of the number one reasons most people are get out of the military if you have flat feet because they simply say that you can't walk or march for long distances and you'll have foot problems and you just won't be an asset to the military. Um, the flat feet is it's fairly common, so a lot of people have it. Um, it's when the arches on the inside of your foot are flattened, allowing the entire soles of your feet to touch the floor when you stand up. Like I said, they're common, and it's most of the time painless, and most people are not even aware that they have a problem, well, a flat feet or of that sort. Flat feet can sometimes contribute to problems in your ankles and your knees um, because the condition can alter the alignment of your legs. A flat foot is normal in infants and toddlers uh, because your arch is usually developed over the adolescence or childhood until you get into adulthood, then your arch is fully formed. So through development, it's a development stage of childhood. Arches can also fall over time through the years. Wear and tear can weaken the tendon that runs along the inside of your ankle and help support your arch. Uh, and that's important to know. So there are birth defects in the foot that can be twisted, but that's called club foot, and that's where this word talipus comes from. Usually they're treated in infancy, and you'll see babies are wearing these leggings and foot braces to correct the position of their foot from being turned inside or outside in one direction. Um, and the common name for it is called club foot. Um, then you have the torticollis, the weak neck or the worry neck. You lean to one side. You're always got to one side, like, and you're talking, you're always one side of your neck and you're walking around one side like that, or it can be the other side. It could be back or forward or down. But usually it's just one position that you're got your neck in constantly because you've lost the ability to move it easily in the other direction. Not that you can't do it. It's just that it's simply more normal for you to have it in this position at all the times, right? That's your normal way of doing it. And so it's an involuntary contractions of your neck. Okay. It may be due to change in the genes, your genetic makeup, passed down throughout your family. It can also be to the nervous system, the upper spine or muscles. The condition can also occur without a known cause. Okay. Um, Total gliosis present at birth. It may occur if the baby's head was in the wrong position while growing in the womb. Okay, so that's another thing too. So while the baby's developing, it might have had to develop in this position, and it's just simply the muscles have not developed properly. So that's another thing to consider. Now, muscular dystrophy. Uh, Muscular dystrophy is a disease in which voluntary muscles deteriorate and can be genetic at birth. Um, this is most of the times people find out that they develop this usually in young adulthood, and it can be very debilitating. Very debilitating. It can be very bad. All right, there we go. Just face it. Sometimes you just cannot speak. This is one of those days. So anyway, just tolerate it. It can be very, very bad. And when it's very bad, it means you'd be wheelchair bound, and you can end up losing even your upper extremity tone and ability to move as well. And it can strike you, in the prime of life. You're around 30 years of age, and you all of a sudden found out that you cannot move as well as you used to, and you go to the doctor, and he says, now you got muscular dystrophy. Well, um, that it's not curable, and that's why it makes this disease very hard to be informed about, because you've lived your whole life all the way up to about age 30 or so, um, very active, uh, very productive, and now you've been told you have this debilitating disease, and you have to live with it for the rest of your life, and there's no cure. So you can hope that it's a minor and it takes a long time for it to progress. Um, and that would be the best case scenario if you have this disease. You're still able to function, still able to do everything every day. You just have your bad days. Um, but some can be very bad, and you end up in the wheelchair for the rest of your life. Here we have myasthenia gravis. Or gravis, myasthenia gravis. This occurs when connection between nerves and muscles is lost. The autoimmune system results in a progressive weakness of the voluntary muscles. What? Well, it's an autoimmune disease. Your body's immune system makes antibodies that block or change some of the nerve signals in your muscles, and these nerve signals are interrupted and they change them. And so you need to have medications like there's acetylcholine that comes from your brain. That's a chemical messenger in your brain that can activate your nerves to signal your muscles to perform certain activities for you. So if you have a problem with, you may have overstimulus of acetylcholine in your brain. So if you have a treatment, you can treat it with anticholinesis, which are enzymes that will inhibit the acetylcholine, and it's a medication given to you to calm down this overuse of the muscle system, so your muscles can be used in a voluntary way. Uh, Weakness. This causes a weakness in your muscles because the signals are being sent so rapidly and so fast that it doesn't give you time for your muscles to fully contract. So what that happens is that your muscles, although they're being stimulated, haven't fully been properly allowed to stimulate and then relax, stimulate, then relax to get the full, like, hey, I'm a working muscle, I need my nutrients. Instead, you're getting this jerking, right? And what happens is that it never really completely does what it's supposed to do. And so it doesn't have the nutritional demands, and your muscles will deteriorate. So that's the weakness that occurs. Treat it with medications, right? Um, the symptomatic treatments are anticholinesis, which I said before, which is an agent that's used to inhibit the acetylcholine. Then you have chronic immunological therapies like glucocorticoids, steroids basically, uh, immunosuppressive drugs that suppresses your immune system. Um, you have rapid immunomodulating treatments that can be used, and you can have surgical treatment as well. So you can see this can be a very there is that word I cannot say today. It can be a very bad disease, right? Debilitating disease. There we go. You got heel spurs, calcium deposits in your heel and or in your bone. And what happens? These deposits are pointed, and as you walk, the tissue is irritated that surrounds this spur. It's like stabbing a little knife right into your muscle tissue every time you walk. So you can see that'd be very painful. And most of the time, the treatment is to pull back the flap of the skin or the tissue and smooth out the spur uh, like a sanding machine or a machine that you can smooth it out with a little grinder, and then treat it with antibiotics. And of course, this is all done in a sterile environment, and re-stitch the muscle tissue back together. Um, but this can happen quite a lot on the feet for the heel. You have plantar fasciitis. Plantar fasciitis is what in fascia we discussed earlier, and I said that we would talk about it again, so here it is. So fascia is a fibrous material um, that connects tissue to the bone and to the muscles, it wraps around the muscle, bone, ligament uh, tissue, and if it gets inflamed, then as it gets inflamed, the inner layer of the epidermis or adipose fat contains it, and it won't be able to expand. So you're actually losing blood flow to the injured area. So it's important if we should be able to control um, our inflammatory system when you have fasciitis. You do the swelling, walking, and usually you elevate your feet if it's in the lower extremities after you've been walking. If you start swelling from down there, so but it's painful. That's distinguishes from just edema. Edema is a swelling that may or may not be painful. So it's important to distinguish between the fasciitis and just a regular flow of legs or fluid into the lower extremities. So we'll go on to the next issue. Now, these are recreational injuries. They deal with sports activities and individuals that are very active. And this can very inconveniently upset someone's normal life activities because they enjoy doing what they're doing, or they wouldn't be out there doing these activities. Now, the first one is tennis elbow, lateral epicondylitis, right? So it's inflamed. Epicondylitis is the inside of your elbow here. It's a connective tissue there. It's a tendon on the lateral side, inside lateral, of the elbow, and it becomes inflamed and it's painful. Um, there's some of the treatments the doctor can do. They can do injections. They can do ultrasonic treatment that they have nowadays under ultrasound guidance. A doctor inserts a specific needle through your skin and into the damaged portion of the tendon. Then you have surgery, which is removing of the crow's tissue or the damaged tissue, and then ensuring that the connectivity is proper for the exercise. Um, it's also can be referred to as a golfer's elbow or baseball injury or batter's elbow. So it's not just not just tennis elbow, not just one sport. Uh, Tendons attach muscles to the bones, as we know, and due to injury or irritation, they can become swollen and painful. And that's what we're dealing with. So it's important to understand that. So we have shin splints. Now, shin splints is is your front of your shin, right? And it's common with runners. Now, a lot of soccer players wear these shin protective gear underneath their socks so that when they're kicked, it's not as painful on their legs or the lower shins. So the shin splints. So this is a football, if you're from England, injury that occurs quite often. Um, so, but if you're in the United States, it's called soccer. So there you go. You have the rotary cuff injury. It's a group of tendons that stabilize the shoulder. This can occur in football injuries and in its rotation, and it's usually weight bearing. A lot of times, your rotator cuff injuries are occurred by your offensive and defensive linemen due to the contact on the initial trying to get a person off the ball. Your tackles, centers, and guards. They have to rotate and spin to get away from the individual as they try to tackle a runner or the quarterback. And this rotation could cause the tendons to destabilize in the shoulders. Um, and it's once again you're lifting a lot of weight. You're lifting the other player's weight up all off the ground and out of your way. So it can be very painful once it occurs. Sometimes you just begin to feel like some of these things in this lesson are very repetitive. And rice is one of them. Rice is a normal treatment for muscle injury, sprains, pulls, especially around the joint area. First one, we always discuss that, the old saying, if you go to the doctor, you say, when I do this, it hurts. And the doctor gives you the treatment of don't do that. And therefore, it doesn't hurt anymore. So that's called rest. And ice is always good to put a halt on the inflammatory process because as the tissue begins to demand the histamine response in our body for an injury, it swells up like this. But then it becomes encapsulated inside with a lot of fluid inside the area wrapped around the muscular tissue area. And then that actually impedes proper circulation because it closes and clamps down on the capillaries that provide oxygen and removes waste to the damaged tissue. So you're actually, the inflammation period is saying, all right, guys, come and help. We need all these antibiotics and fluids and nutrients and all this stuff to the site. But then when it does that, it overwhelms the site because the outer layer of the skin acts like a ball that can go no further and stretches no further and keeps trying to fill up, and the vascular system clamps down and closes, and now you have all this fluid mass sitting there like a pustule without any nutrition, without any way of moving the waste that is occurring, and it's going to necrose. So it gets bad. So ice prevents that whole histamine response from getting too carried away, and so you get a slight swelling instead of this, which impedes the healing process. Now, compression is the same thing. Compression, you've got it around joint area. You want to make sure that you use the compression in such a way that you prevent the joints becoming so swollen that you impede the joints from its functional or connectivity to the other bone. So you can actually deteriorate and deform your joints if you don't. Compression in this area, I would highly recommend be done by a professional because you don't want to impede the circulation at the same time. You just want to kind of mold that response, that inflammatory response, from occurring in the wrong areas. Elevation prevents the fluid from getting to the site as well. Once again, we're trying to prevent this histamine response of, hey, send all the fluids here, give me all the weapons, antibiotics, blood, and everything, oxygen, nutrients I need. I got a boo-boo. Come help me, come help me. So what you're going to do, you're going to put this above your head, your arm or your hand or the injured part away from the heart and high so that it has a long way to get there and it won't swell as much. Now, all you're doing is slowing down the inflammatory process, allowing the inflammatory process to do its job properly by allowing it to remove its waste as well. But these things are chemical responses in our body, and it doesn't necessarily know that, hey, if I go too fast, I'm going to cause more injury. It just knows I got to get there, and doesn't realize that it's clamping down and removing its exit that it's going to remove the bad tissue with. So it's important to understand that this whole process of rice is to impede the inflammatory response, so you have time to have proper removal of the necrosed tissue. So, effects of exercise on the muscles. It alters the size, structure, and strength. Now, we talked about atrophy earlier in this lesson, It hasn't changed. The lack of exercise, you lose it. It gets smaller. The muscular tissue just actually deteriorates into a smaller size and actually in weight and volume. So it's important to understand if you don't use it, you lose it. And every time you use something in our bodies, it's a remarkable machine. It says, hey, I need nutritional value in this area of my body. So it demands on your body to provide the nutrients so that it can build. And here we have hypertrophy. Now, hypertrophy is the enlargement of the muscle sizes. So if I use weightlifting, I'm putting stress on the muscle, and I allow rest in between. Uh, Now, it says here steroid use. Well, your muscles will hypertrophy without that. Uh, Simply the fact that if you properly allow nutrition to do its thing and you properly stress the muscles with weight, um, it will get larger in size. Now, yes, I'm not going to deny it. Steroid does speed it up, and but at the same time, steroids has a lot of side effects that should be avoided. Um, then we have scar formation. I have a very proud scar. I don't know if you can see it too well. It's right there in the palm of my hand. It's right there. It runs. See how it runs through there? That is a scar. I got that playing football. I know, kids will be kids. I fell on a Coca-Cola bottle that was on a football field, and it was broken. And the bottom of the bottle was here, it's a big circle, and the glass penetrated right through the entire hand. And I played another 2 downs before the coach discovered it. I was like, pretty, pretty concerned about the football game. And sometimes kids do that. But anyway, I had it stitched up, and it's one of the many numerous injuries I got as a child. I have quite a lot of scars from childhood. Um, the scar is basically the body's glue. It is formed through a highly organized sequence of physiological events. The ability of one type of cartilaginous tissue to weld various tissues, uh, adapt to their structural integrity, impart tensile strength, and permit return of function is revered or reviewed. Now, this requires a continuous monitoring of the body. The body, like we once again, the first phase is the inflammatory phase. The inflammatory phase sends all the nutrients to the area because, hey, I got a boo-boo. We need all these uh, antibiotics. We need blood. We need nutrition, some fuel, oxygen, and the means to carry the waste materials away. And fibroblast occurs. It's the making of tissue, the remodeling of the skin, let's say, or the remodeling of the injured part, fibroblast. Then you discuss cellular processes occurring in each phase, um, which happens. You have at the cellular level. This is the antibiotics, the nutrients that are being provided, the oxygenation, the blood flow. Uh, then you have appropriate intervention methods based on researches, right? So it's important to understand what's happening when you have a scar being formed. So basically, three things are happening, right? The inflammatory process, right? The fibroblast, the forming of new tissue, and the remodeling, which occurs to return it to function, to reshape it. So I've discussed some of this before in an earlier lesson concerning the remodeling and the enzymes used to remodel and reshape and to get it back to proper form. So scars are quite common. Um, Depending on where the scar is located, you might want to try to seek a dermatologist's attention to alleviate its prominence if it's in certain areas that you like your face and things like that. They can be treated. Many scars can be pretty much treated quite well today with today's sciences. So it's a good thing to know that if you have a scar that you want to get rid of, it's quite possible. So you ever wonder what happens when let's say you're a young individual and you've been drafted, and no longer drafted in the military, and you pretty much thought you were in great shape. Well, you've watched some of these guys. Some of you have watched these war movies where the guy goes to boot camp and he gets into shape. Well, that's what this is about. You have to have a plan in order to affect your conditioning. So improved conditioning means just that. We're going to improve your conditioning to survive uh, in a strenuous environment, and that usually incurs your breathing, your circulatory system, right? Uh, and you're going to lose your excess weight that you don't need, but you're going to build what you do need, which is muscle strength. So you're going to lose fat. Fat is the excess weight. But you got to also understand that fat is also a food reserve. So it's natural. It's a natural process because the humans, um, we used to be what you could say nomadic. We would have to follow our food around, and fat was a luxury. And fat is what made us survivable during the lean times. Then we learned how to farm and learn to stay in one place, and we decided to raise our animals for our meat, and we didn't have to move so much. But for thousands and thousands of years, uh, the body demanded that fat be stored away for future use for fuel. And that's where we carry these big bellies from, because we had the tendency that if you don't need to use it now because you're not using enough energy, we're going to put it in fat. We're not going to eliminate it. We're going to hold on to it because our genetic makeup tells us that there's going to be starvation periods. We may go days without being able to eat. And that's what that genetic cycle is still encoded into our DNA, into our life cycle. And it's very important to understand that fat does has a purpose. Um, Improved joint movement, that also occurs. It builds up the strength in your ligaments, the elasticity in your body. Once again, if you don't use it, you lose it. So these are your joints as well. And the tissue and fluid fields are improved, and the cushioning is improved in the joints. It be due to the fact of exercise. Increase in muscle size occurs when you're building up strength in your muscles. We talked about hypertrophy, and that increases your muscle size due to the fact of the exercise is increased, and over time your muscles enlarge. Now we have improved agonistic muscle coordination. Well, we kind of discussed this in a previous lesson plan about the muscles, the first slide I did on muscles. I mentioned eccentric and concentric movement of the muscles. Um, uh, agonist, agonist, you can see it right there. A-N, in the AGONIST in the word agonist is there. Agonist is is the muscle is contracting. The muscle, when it contracts, it agonists, right? It contracts. When we talk about bicep, this is an agonist. And then the muscle relaxing is an anti-agonist underneath it. So once again, I described this as a concentric and eccentric in a previous video that I did. Uh, but they're basically terms to understand the contracting and relaxing the muscles. Improved agonist is the muscles are improved at the relaxation phase, which means it is more pliable, ready to respond to stimuli than one that is not improved. So um, your control of your muscles and muscle tone is better. Improved functioning in the cortical brain region and the nerve impulses that start the muscle contraction origination. So hand-eye coordination, right? Um, uh, Muscle memory. All these things are cortical brain regions that it can improve in your muscle hand-eye coordination and muscle responses. So if you're studying, let's say, a lot of people say dance moves and things like that, but a lot of pins, it could be self-defense, like karate or judo, is doing the movements over and over again, and then learning to use them in a contact relationship. The more you do it, the more memory muscle you have that allows you to do it in a more efficient, rapid manner to protect yourself. When you're dancing, dancing it deals with muscle memory as well, because the more you do the routine, the more you remember it, and the more the flow is better, and it certainly becomes a more enjoyable and visually uh, pleasing thing or event to watch, because I love to watch ballet. I mean, ballet, any kind of dancing along the ballet area is just, I really like that. Especially they call it modern dancing. Um, my girls, both my girls, I, we went to, they went to dance school, and I really was like, hey, like my son was, I have a son, he did all the sports, and I coached a lot of it, and I was like really going for it. And I also coached the dancing too. I had to teach myself the moves. It was kind of nice. But the muscle memory is important. So when you go to do your routines, you're all moving as one, and it's important to it really provides an advantage, especially in competitive dancing, which my girls did, and in sports. My son it was in competitive in sports as well. Massage of the muscles, usually done by a massage therapist. It tells you what it is, basically to promote relaxation of the muscles. The health benefits are listed there, stress, and the endorphins. Endorphins is a releasing mechanism um, inside the body of hormones that allow you long distance runners to endure and just continue running and running and running and running. Some people refer to it as a runner's high or the endorphins high. It's quite exhilarating. I've achieved it a couple of times in my life as a young runner in track and field, and I can definitely attest to the fact that endorphins is a very pleasant experience, and it allows you to just keep on going. It's really a pleasant thing to be. Once you relieve the endorphins, you don't feel too much pain because the endorphins mask the pain. Then you have the sweetest massage, or a deep tissue massage. It's done by a massage therapist. It's not done by any run-of-the-mill individual that wants to give you a voluntary massage. Okay, so and it's important to understand that a massage therapist is a true professional, which means that they will evaluate. And then, in the world of medicine, there is an adage that states that treatment should never be administered without a diagnosis. So, your massage therapist, if you've ever used one, when they're first introduced to you, they will make their own assessment and evaluate whether, in fact, the diagnosis is indeed true. If that does occur, then you've got yourself a pretty good massage therapist. An assessment informs the therapist about the physical integrity of the tissue, the client's body, that are to be treated. So they will assess the integrity. Uh, the points the therapist towards the appropriate treatment tools to be facilitated in the healing of the condition. So the goal is to heal your condition. Tissue massage focuses on painful, stiff, trouble spots in your body. So the deep tissue massage is not a fun event. Okay? The therapist uses slow, deliberate strokes that focus pressures on the layers of the muscles, tendons, or other tissues deep under your skin. Though less rhythmic than other types of massages, it's a deep tissue massage can be quite therapeutic. Release chronic pain patterns of the tension and helping with the muscles injuries such as your back sprain. Um, these are some of the reasons why you would use it. You have chronic pain, limited mobility, uh, recovery from injuries like whiplash, falls, sports injuries, repetitive strain injuries, the carpal tunnel syndromes, carpal in your wrist, right? You sprain your wrist. And osteoarthritis pain, fibromyalgia. Now that's a pain that can be in any location of the body, and it can occur sporadically or continuously. So it's not a pleasant thing uh, having fibromyalgia, but deep massage therapy or deep tissue massage can alleviate that. It's nice to know that. So the good therapist must be aware of the muscle groups and the layers of them in order to ensure their proper location. So a therapist is quite knowledgeable and quite important in the treatment of injuries. Now this is a therapy that I can never had and I've never seen administered before, to be very truthful about. But I've certainly heard about this, and it's used to increase the range of motion. You may say, why would someone want to volunteer to be electrocuted? Well, it seems to improve the electrical stimulus to the tissues, builds up the neural uh, collagenic responses in the tissues, and allows the tissue to be better stimulated in a natural manner after the electrical stimulation. So it actually can improve your range of motion. So if the patient is experiencing a limited range of motion, they may be able to receive this kind of a treatment. And it's kind of a unique thing. It says it does not produce heat or cold. Your body, your muscles are just basically neurologically being stimulated. They don't use enough electricity to cause pain. I'm certain that there's a tingling effect, maybe a slight discomfort. But the point of the thing is to motivate your your collagenic responses to muscle movement. This is an interesting event for me. I'm going to show you where the ejection sites and the intramuscular common injection sites. Well, right here is the deltoid, and this is the common injection site. It's where you get a lot of the polio vaccines and things like that. And some people have that little scar from the immunization when they were young, and they have it right there. But that's exactly what the deltoid upper arm area is at. Then you have the vastus lataris anterior thigh, right? Well, I'm going to have to bend this down a little bit, like so. And I hope you can see the side. It's right here, right? The vastus lataris, right on in the outer part, right there. Okay, it's the outer part. And then you have the deltoid gluteal. The deltoid gluteal is right there in my back pocket, right in that area there. Okay, and then you have the ventral gluteal, which is a V-shaped area, like this. It's usually the other way around, right in this area here, right about there. Okay, and you eject where the V is at. Now, it's important that you teach yourself, if you have to give injections, uh, just where to locate these specific areas are. And there are anatomical markers and little tricks that you can use that is in many of the books and illustrations that show you how to locate these muscle sites for the injections. So it's a nice skill to know. Okay. I'd like to always leave the students with references that they could use to further their education. If they have any questions concerning the subject matter of muscles. You have your primary instructor, which could be located on Blackboard under the faculty availability prompt. You click on that and it gives you the information how to contact your primary instructor. And you can make arrangements to discuss uh, learning material with your instructor. Then you have the book. The book is online. And if you have a prompt in your lesson plan, it says reading, textual reading. You could click on that, and it takes you to the reading uh, and on the internet, on the website. And there's a search engine for your book that you can look up any word or any item you want. It also has a lot of options available to you. It has a glossary, a dictionary. It has the chapters laid out in front of you. You can read the whole book online. So that's a nice tool as well. Then you have the UMA has a library. It's online. It's a computer library. It has videos, journals, illustrations, articles that you could use to enhance your education as well. And I would highly recommend using the UMA library. Um, Once again, it's been nice to be nice being your instructor during this lesson plan, and I'm wishing you the very best.